How long should an epileptic seizure last before calling 911? Imagine witnessing someone having a seizure and wondering when it's time to seek emergency help. Knowing the right moment can be life-saving. If a seizure lasts 5 minutes or more, it is considered a medical emergency. This is because it meets the criteria for what doctors call status epilepticus, which is a prolonged seizure that can be very dangerous. Status epilepticus is defined as a seizure that continues for 5 minutes or longer, or when multiple seizures happen back-to-back without the person regaining consciousness in between. This change in definition from the older 30-minute guideline is important because brain injury and complications can occur much earlier than previously thought. Most seizures usually stop on their own within 1 to 2 minutes. But if a seizure lasts longer than 5 minutes, it is unlikely to stop without medical help, and the risk of brain damage or even death increases. If you see someone having a seizure that lasts 5 minutes or more, calling emergency services immediately is crucial. Also, if the person has multiple seizures in a row without waking up in between, you should call for help. Caregivers should be prepared to call emergency services if a seizure is close to 5 minutes, especially if the person has a known seizure disorder. There are other reasons to call 911 even if the seizure is shorter. If the person has trouble breathing, is injured, pregnant, or has no history of seizures, emergency help should be sought. Both convulsive seizures, which involve rhythmic jerking and loss of consciousness, and non-convulsive seizures, which may only cause confusion or altered awareness, requiring urgent medical attention. Emergency treatment often includes giving medications to stop the seizure, ensuring the airway stays open, providing oxygen, and monitoring in a hospital setting. Acting quickly and recognizing when a seizure becomes prolonged can prevent serious complications and improve recovery chances. In summary, if a seizure lasts 5 minutes or longer, or if multiple seizures happen without recovery, calling 911 right away is the safest choice. Always remember that individual situations vary, so consulting a healthcare professional for personalized advice is essential. Being prepared and knowing when to seek help can make a big difference in outcomes for someone experiencing a seizure.